Good evening, and welcome, distinguished faculty and staff, fellow graduates, family and friends. It is an honor and a privilege to speak with you as the UCLA School of Nursing pins its first graduating class of the Master's Entry Clinical Nurse Program. When we started this program in September of 2006, my son Bryce was 16 months old. He had just started walking and spoke maybe 3 or 4 words. A few weeks ago, he turned 3 years old. Now he is constantly on the move and has a vocabulary of what seems to be a few thousand words. I think my classmates would agree. It is absolutely amazing how much you can learn in such a short period of time. When we started this program, most of us couldn't even pronounce some of the disease conditions like glomerulonephritis. Now we can all tell you the risk factors, signs, symptoms, and treatments. In the 21 months we've been in this program, we too have been constantly on the move. Our class has seen the birth of 3 babies, had 3 engagements, now as of yesterday, 4 engagements, 2 weddings, and a couple of classmates who became, well, a couple. Most notably, however, our class has become a family that has all grown up together, all of us with a common mission in mind. We are committed to entering the nursing profession ready and equipped to act on behalf of our patients, our healthcare system, our nation, and ourselves. Through these 7 quarters, we've had the opportunity and honor to work with some remarkable people. Our faculty, our administrative staff, the clinical liaisons, and the nurses at our clinical sites. As a class, we were amazed at the working relationships and trust we quickly built with all these people. Some suggested the ease of these relationships came from the fact that we were adult learners, but I think it was more than that. I remember one of our early fireside chats when we acknowledged how understanding, caring, and open the faculty was to our input. And in response, I believe it was Dr. Suzette Carden, the Assistant Dean of Student Affairs, who said, "It's because we're nurses." The past 2 years have been intense and time-consuming, to say the least. We've all had to make sacrifices in our personal and family lives. And now that we can finally lift our heads out of the nursing journals for just 1 minute, we'd like to thank our families and our friends for supporting us along the way. There's no way I could possibly mention everyone who has had an influence on our being here today. But I would be remiss if I didn't single out the late Dean of the School of Nursing, Dr. Marie Cowan. If not for her vision of this program, most of us would probably still be on a waiting list for a community college nursing school. We know she wanted more than anything to be here on this historic day. As a class, we were able to come this far under her watchful eye. And although she's no longer with us, we know that she's still watching. We will become the leaders that she envisioned. This Saturday's keynote speaker, Dr. Joan Shaver, once said, "Leadership is not about power or position. Rather, it's about the power of having positive influence on others, no matter what your position." We cannot wait to rise through the ranks before we start leading. We must begin leading today. It is with this in mind that we, as clinical nurse leaders, must face these 5 challenges. It will not be enough to treat patients using evidence-based practice. We are charged with performing the research that leads to the establishment of these practices and sharing this knowledge with our fellow nurses. It will not be enough for us to care for our patients based solely on what we as nurses can do for them. We are charged with coordinating the various team members participating in their care. It will not be enough to recognize that significant healthcare disparities exist among certain segments of the population. We are charged with addressing and advocating on behalf of those vulnerable populations. It will not be enough to advocate only for our patients. We are charged with advocating for the nursing profession through our participation in policy making, leadership in healthcare settings, and nursing education. Finally, it will not be enough for us to do things in a particular way because that's the way they've always been done. We are charged with researching and implementing new procedures that will be more cost-effective, more efficient, and have an improved effect on patient outcomes. If we let these 5 charges guide our nursing careers, we will have earned the title of leader long before it's ever assigned to us. Let me finish by sharing a quote from world-renowned author George Bernard Shaw. "It is you, and only you, who determine who you will be and what you will do for the rest of your lives. Do not follow where the path may lead. Go instead where there is no path, and leave a trail." In September of 2006, we made the decision to go where there is no path. As we stand here today, it is up to us, the nurse leaders of tomorrow, to leave a trail worth following. Thank you.